Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey. And today I have in our podcast studio Dr. Kiersten Riedler. She's a board-certified plastic surgeon and focuses on facial plastic surgery. And today we're going to talk about blepharoplasty, which is the fancy word for eyelid surgery. And we're going to talk about recovery for eyelid lifts and how much time can you expect to be down, et cetera. So welcome again to the podcast, Dr. Riedler.
Hi, thank you for having me.
Thank you. So eyelid surgery, while it kind of sounds like it would be a painful experience, it's not necessarily that way. And so I want to sort of maybe go through and we can debunk maybe some myths or things that people say to you, or what are the things that they're worried about, because we want patients to feel as comfortable as possible during that recovery period. And we want you to go into surgery feeling like, okay, I know what's going to expect. So how long, I think the first thing people might want to know is anesthesia related. So how long are they typically under anesthesia for an eyelid lift?
So if you're undergoing only upper blepharoplasty or lower blepharoplasty, because there's both upper eyelid surgery and lower eyelid surgery, if you're having one of those surgeries, you can expect to be under anesthesia for about an hour and a half. So it's fairly quick.
Okay. And if they're going to have both, do we double it like to 3 hours or ish?
2.5. Yeah, 2.5, 3.
Okay. Well, that's not too bad. Now, do people experience, like, let's say you're in the recovery room and is there a lot of pain right afterwards or in that first 24 hours?
Usually not. Patients are typically very comfortable when they wake up in recovery, and our recovery nurses always make sure that they're comfortable and pain-free. And then during the first 24 hours or even over the first few days, patients don't have a whole lot of pain. Usually their kind of maximum pain level is maybe like a 3 out of 10, which isn't too bad.
Yeah.
It's more like discomfort, swelling, bruising, some like pressure. Those are the main kind of symptoms during recovery, but it's really not that painful.
And for anesthesia, how does it feel, or how do you describe it for people who maybe they've never undergone an anesthetic procedure or where they're under general? How does that feel to recover from?
Yeah, everyone reacts differently to anesthesia, but recovery from anesthesia is typically pretty easy. We watch you in the recovery room for about an hour while you wake up completely, and it's totally normal to feel kind of sleepy or groggy for several hours. Occasionally, patients get nausea, so we always give medications during surgery and sometimes in recovery to prevent that. But overall, it's just kind of like you go to sleep and you wake up, and it's like you just nothing ever happened and it's all over.
Isn't that funny? It's like there is no sense of time. Like at least when you wake up in the morning in bed, you're like, you slept. There's some time. But that anesthesia is they're like, okay, count backwards from 100 and you get to 98.
Yeah.
If you're lucky.
And they're like, did we start yet?
And they're like,
it's over.
You did so good.
Yeah, exactly.
So now, anytime a patient has had anesthesia, they can't obviously drive themselves home, nor do we let you Uber home. No. You need to have a friend. So tell me a little bit about what you recommend for people as far as having somebody there to help them.
Yeah, so you definitely need a ride home from the surgery center with preferably like a family member or friend. And we also have aftercare services that we're happy to arrange as well.
And then what is that in that first 24 hours? Is there anything they have to do with their eyes?
Yeah. So for the first week or so, I have patients use a Q-tip dipped in hydrogen peroxide just to kind of clean along the incision lines and then put antibiotic ointment on. And then for the second week, they'll do kind of a similar thing just with Aquaphor ointment. The most important things really to do are to keep your head elevated, to reduce the bruising and swelling, to not be really active or do anything that's going to make your blood pressure jump up, because we want you to heal as well as possible and as quickly as possible.
Yeah, people don't realize, I think, that you can really, even doing something kind of minor that doesn't seem like it's you're not working out, but like anything that elevates your blood pressure, you're right. That'll be like that puts pressure and swelling gets worse and then you feel bad.
Yeah,
And I think
exactly.
it's not like I agree because I had my face and neck and brow and
Mhm.
lower eyes done, but it's been almost 20 years.
Oh,
So
wow.
it's a long time ago. But so I didn't really have pain, but yeah, you have a little discomfort. I think that's a
Mhm.
great way to put it.
Mhm.
And I think in talking about keeping your head elevated, if you don't have an adjustable bed at home, which is like the best thing I've ever bought in my entire life.
I know, same here.
But if you don't have an adjustable bed, find those wedges or something that's
Mhm.
going to keep you comfortable because definitely, and this is true for all the surgeries you do, all the head and neck
Yeah.
surgeries, keeping that elevation and so that your back doesn't hurt
Yeah.
while you're trying to prop yourself up. So I think that's a great thing to think about pre-surgery to, okay,
Exactly.
what can I use that's going to be comfortable? So I'm, again, keeping the swelling down. Do they
Mhm.
need to put ice packs or anything like that?
Yeah, definitely ice packs and cold compresses help a lot as well. So I have patients do that at least for the first 24 hours, preferably for the first 2 to 3 days.
Oh, okay. And then are their eyes going to be swollen shut or are they open? Or, I mean, I'm assuming you can see, but
Mhm.
like, what does that look like in terms of for them
Yeah.
to expect?
I mean, the eyelids get pretty swollen. I'm not going to lie.
Okay.
So,
Okay.
I mean, they're not, I wouldn't say that they're swollen shut, but they are, I mean, they're pretty swollen. So definitely you don't have your full field of vision for at least several days because of the
Okay.
swelling. And you want to definitely be careful moving around and have somebody with you because the last thing we want you to do is, hurt yourself.
Right.
So it can be, what I tell patients is that you look a lot worse than you feel. You don't feel
Ah,
that. You don't feel that bad. There's discomfort. It looks like maybe you should be in pain, but you're really not.
yeah. Well, I think that's probably true when you do facelifts too, right? They
Yeah.
have more,
Yeah.
you get all the bandages and the,
It's really,
and
it's pretty much true with all of the surgeries I do. Even with rhinoplasty, you look worse than you feel too. It's kind of standard, which I mean, I think is probably a good thing. I'd
oh, for
rather look
sure.
worse than feel worse.
Yeah, yeah. So, and I'll tell you a funny story. So, way back in the day, my dad had his eyes done, and they did it. I think they did it under like a local with sedation or something. So he didn't
Mhm.
even have a general. He went to a Christmas party that
Oh
night
my
with,
gosh.
I mean, he didn't mind telling everybody because it was his brother-in-law who did the surgery, but he wore sunglasses and it was a talking
Oh,
point and he was super gregarious, so he didn't care.
yeah.
But it was like, to your point, and probably that was not the best idea.
I-
But I don't think he stayed long, but it was just
yeah.
funny that it really was. He sort of looked a little funny, but
Yeah.
yet he did feel okay. And
Mhm.
while we
Yeah.
don't condone that behavior, it does kind of speak to the point of,
Mhm.
you look worse than you feel. So
Exactly.
now do they have like I'm trying to remember from my dad, there was
Mhm.
maybe some steri strips or there's like what is put on and are there any sutures on the outside?
Yeah. So there are sutures on the outside. Those stay for about a week. And then I don't put any like bandages or wraps around the eyes or anything like that. But usually I'll put a few little steri strip tapes kind of next to the eyelid or under the eyelid. And those just stay there for a few days until they fall off.
Oh, okay. Well, that sounds kind of easy. So let's get past the first 24 hours. When do they come back and see you again?
So I have patients come back about a week after surgery. And at that appointment, I remove the sutures, just see how they're healing, take photos, kind of go over the next steps and all that.
Now, you mentioned earlier some bruising. Is it typical for like upper or lower or both? And how much bruising is it? Does it look like somebody punched you in the face or is it just sort of black and blue a little bit?
It honestly varies a lot from patient to patient, but you can count on some degree of bruising, whether it's a little or a lot. Like I said, it kind of depends on the patient and what you've had done. But the bruising and swelling both kind of peak around 2 or 3 days after surgery.
Oh,
And I would say the bruising typically lasts about 10 to 14 days. The swelling lasts a little bit longer. So the majority of the swelling goes away within 2 to 4 weeks after surgery, but it really takes at least 6 months for all of the swelling to go away.
interesting. And now what would you say as far as being noticeable? Like if you were thinking, okay, I'm going to, a wedding and the wedding's in 3 weeks, are they going to know that I had something done?
They might not know, but I wouldn't recommend going to a wedding in 3 weeks just because that's a
Okay.
little close.
Okay. So if they're planning ahead for an event, let's say,
Mhm.
let's just stick with a wedding
Yeah,
analogy,
sure.
or a high school reunion or something
Mhm.
like that. How much time would you say in the perfect world, if that event is on August 1st and we're in April, are we
Mhm.
having surgery now? Or, when would you want patients to
Yeah,
really have the time to recover?
soon. I would say you're having surgery soon because if you have an event that you know is coming up, I recommend patients try to have surgery about 3 months beforehand at least so that they can look, their best. That said, even at a month and at 2 months, your eyelids are going to look better than they do before surgery. So it isn't necessarily a bad idea to have surgery a little bit closer if you're in a time crunch. But, to be conservative and plan ahead the best way possible, I would say 3 months ahead is a safe period.
And when could they wear, let's say, some concealer to maybe, I don't know, once the stitches are out, and
Mhm.
if they have some areas that they feel like aren't quite, they're not going to be, I mean, things will be red at the beginning, I'm
Mhm.
assuming. So
Mhm.
when could they put a little makeup on to cover up if they have anything to cover up?
I mean, you can put makeup on your face away from the incisions at about a week, but you can put it like on the incisions or around the eye area itself at 2 weeks after surgery.
Okay, so a couple weeks. That
Mhm.
makes sense. Now, what things do you recommend, like in the perfect world, if I was going to say, okay, I want to set myself up for a great result, what things do you want them doing, maybe skincare wise or diet wise or medication wise prior to surgery? And then afterwards, what do you recommend that they do?
So, before surgery, again, to minimize bruising and swelling, it's really important not to take anything that can make you more prone to bleeding for 2 weeks. So that includes like aspirin, Advil, ginkgo biloba, fish oil, and things like that. That goes for before and after surgery. Other things that you can do to be proactive are like taking arnica, which is a homeopathic supplement that if you start taking a few days before surgery, that can reduce bruising and swelling also. And then skincare wise, I have my patients use an elastin skincare regimen, and that includes for eyelid surgery enhanced serum after surgery, and that has several ingredients, including arnica, that helps reduce the bruising and swelling around the eyes. And it's also good to have things on hand like cold compresses or ice packs, the wedge pillow that Monique expertly mentioned, and Q-tips, hydrogen peroxide, Tylenol, Aquaphor ointment, things like that. I also tell patients ahead of time it's a good idea to have like audiobooks or music or something you can listen to so that you're not kind of reading and using your eyes a lot or even like watching a lot of TV or movies. It's optimal to be listening to something instead of using your eyes as you're recovering, at least the first few days.
Okay, another question that people might have. So, because you were talking about that field of vision being a little bit closed, when might be a good time that they can expect that they could drive again?
Yeah, so driving, you can drive as long as you're not taking narcotic pain medications, and you can see clearly. So usually that's about 5 to 10 days after surgery.
Okay, so that sounds pretty easy. And you know what? Here's the thing, people, with Instacart and all the things
Oh
that
yeah.
deliver, Uber Eats, I mean, you can get your groceries, you can get something from CVS, it all can come to you. So I think that is a really wonderful little side benefit, especially if you live alone, that you're not having to worry about.
Yeah, use it as an excuse to take a little mini vacation and
Yeah,
let people
yeah.
wait on you.
Well, and I love the idea of having audiobooks. That what a great idea. Or podcasts. You could you
Podcast.
could you could catch up on all the podcasts that you missed from the La Jolla Cosmetic podcast. So
Yes.
now let's think about work. And depending, obviously, it's very dependent on what you do for work. If you are a, you know, package sorter at the mail, or, a UPS driver or Amazon, if you're lifting, that's going to be a lot different than if you do what I do, which is sedentary desk work. What do you kind of give the patients as a guideline for getting back to work?
So in general, I recommend taking 2 weeks off of work to be conservative, but you can often resume working if it's like working from home or desk work after about 10 days. However, you really shouldn't be like lifting anything heavy, bending over a lot, things like that for 3 to 4 weeks. So it really depends on what you do for work. But as far as like anything that's like sedentary, usually by 10 days, people are okay. But I recommend taking 2 weeks off just in case they're not feeling up to going back to work full time right
Okay.
away.
And let's talk about traveling, because some people travel a lot for work,
Mhm.
or maybe they come to you we have patients come from all over all the time to have surgery with us and let a little rejuvenation vacation, as it were. So if they were, let's say, when would you want them to say, okay, yeah, if you're in town or you need to go on a plane, how long until they could do that?
I mean, it depends. It kind of depends on the situation. If they're just like coming into town and then flying back home, I have patients do that right after their sutures come out, like 8, 9 days, 8 to 10 days. But if you're thinking about going on a big vacation to like Hawaii or something like that, that's a little different. I would say wait a few weeks.
Mhm.
If it's just a quick business trip, I mean, the flight itself isn't really an issue. The issues with flying are that number one, with the reduced barometric pressure when you're on the flight, you can swell more. But usually,
Yeah.
once you come back to Earth, then it kind of goes away. It's not a huge deal unless you're
Okay.
going to somewhere at high altitude like Denver. The
Oh,
other issue is lifting luggage and suitcases. So try to have somebody help you with that.
yeah, for sure. For sure. And they've moved. The last few times I've been on a plane, they've redesigned the plane so much that the interior space now, the overhead baggage compartments are higher, which gives everybody more
Yeah.
headroom and everything. That's
Hmm.
great. But for short people like me, it's like impossible to get anything up there. And then
Yeah.
once it's up there, I still can't find it to see it. Like, it's so
Hmm.
funny. So, and people don't think about that. Like, yeah, sure,
Yeah.
you can be in a plane, but you have to be super careful with, you know, exertion. So that
And
kind
not
of,
letting the luggage fall on your face as people are getting it out. That's like one of my biggest fears for patients.
yeah. Oh, yeah, it would be terrifying. Now, what about, we talk about working, getting back to work. What about working out? When could they go back in the gym, and what do you recommend?
So you can go back to the gym and like vigorous exercise at about 3 to 4 weeks, but it's kind of a gradual getting back to activity. So I encourage patients to walk around the house for the first week, several days a week. And then the second week, taking maybe longer walks, increasing their activity, and then gradually easing back into physical activity after that. And then by 3 to 4 weeks, you can basically go back to your usual physical activity in the gym.
Okay. Now, a lot of times patients want to, combine eyelid surgery with something else. Maybe it's facial fat grafting or a brow lift or a facelift or some chin lipo. I don't know. How does getting multiple procedures affect your recovery time?
Yeah, so getting multiple procedures at once just means it'll probably take a little longer to recover fully because you have swelling in multiple areas. So, and then depending on what procedure you have, the specific instructions and the follow up visit schedule might be slightly different. But other than that, it doesn't dramatically change anything.
Okay. Yeah, because I had it when I had that facelift, the prior thing that I told you about
Mhm.
earlier in the episode. I was at a wedding in 3 weeks,
Oh,
and
wow.
nobody knew. And
Yeah.
obviously you're using makeup and doing
Yeah.
that, but I told some people, and they were like, "Really?" But I was able to sort of cover things up between makeup,
Hmm.
my hair. Nobody really had a clue, and I knew I looked puffy and funny, but nobody
Hmm.
else. People don't care. They
Yeah.
don't. They
Yeah.
don't.
I mean, you're
They know
always the most sensitive to, to it
for
more
sure.
so than other people.
Absolutely. Yeah.
Mhm.
They don't think about you as much as we think
Yeah.
they do.
Yeah. That's true.
So let's talk a little bit about complications. What are possible complications that could happen after eyelid surgery or during recovery?
Mhm.
And maybe how are those complications managed?
Yeah, so the most common complications are like dry eyes, temporary blurred vision, bleeding, swelling, complication versus like normal recovery, it's sort of a continuum. But those are the things that's why I follow up with my patients really closely. And I would say bleeding is the most urgent type of complication that we want to look into and, manage as soon as possible.
And how can that happen? Like they're at home, let's say, in that first 24 hours, the first 2 days. And can that bleeding happen because of some straining that maybe they're doing?
I mean, often high blood pressure. A lot of people have high blood pressure or, straining or anything like that can make the blood pressure rise. The other thing that can make blood pressure rise is pain. So it's important to, manage the pain and keep on top of pain control. Like I said, there usually isn't a whole lot of pain after eyelid surgery, but that's something to kind of look out for also. If all of a sudden you're having a lot of pain, it might mean something's wrong and you need to call me.
Yeah. And that's what I was just going to ask. Who do I call if something goes wrong? So
Me.
Okay. And that's, it's really wonderful that, being in a group that we're in, even if you happen to be, you were just saying right before the episode started that you're going to be going to Mexico for a service trip. And so they can't call you, but maybe you've got 5 other surgeons with you who are going to take care of your patients in that you're almost never gone. I feel like you're always here, but, but, that's the other thing is sort of like, who do I call? Oh my gosh, she's in Mexico on this service trip, but it's okay. We've got somebody for you and your nurses and
and I mean, you can always call the office because, I might be in the operating room or, busy with the patient or something like that. But if something urgent is happening, I always tell my patients, like, call me first. If you can't reach me, then call the office, call my nurse. But rather than, just going to the emergency room or something like that, I want to know what's going on and try to care for my patients myself.
And then as far as like final results, like final, I guess, is also a moving target in a way, or not a moving target, but everybody might interpret final results differently. But how would you say kind of like, okay, that everything's healed, the scars are mature, that you would call that final?
So about a year is a good kind of, in a lot of the surgeries we do, about a year is when you can expect to have like final results with the scars are fully mature, all of the swelling's gone, you have your final result. That said, you probably have 95% of your final result at 6 months.
Got it. And do those results last forever?
So you will continue to age, unfortunately.
Darn it.
I know. But your results won't disappear. So like eyelid surgery will turn back the clock, but it doesn't stop the clock. I would say most patients wouldn't be a candidate or be interested in another eyelid surgery for about 15 to 20 years. So it has pretty good longevity.
Yeah. And really, like I said, it's one of those things that I think people notice first about you. The eyes are the windows to the soul. But it is sort of like having, if they have puffy bags underneath or there's that drooping of the upper eyelid skin, that really you can get kind of a new, take off, I don't know, 5, 10, 15 years by just fixing that area around the eyes. And I know you work also in the med spa with injectables. And are there certain things that you would say, okay, maybe the plan is to make your face more youthful, an eyelid lift, and then some other things that are in the med spa?
Yeah, actually, that's a good question because, I mean, Botox and Dysport and Xeomin, the neurotoxins are a great adjunct to surgery. They can definitely delay aging, but they aren't going to stop you from getting like excess skin or bulges on the lower eyelids. At the same time, surgery alone isn't going to prevent you from getting crow's feet or completely take away crow's feet. So I think for the best results, I really like my patients to get neurotoxins kind of regularly, like before and after surgery, in addition to the surgery itself.
Yeah. And could they have Botox like a month before surgery? Does it change anything what you're doing?
No, and in an ideal world, I like my patients to get it like about 2 to 4 weeks before surgery so that it's kind of kicked in. Because one thing Botox does is it reduces kind of any pull along the incision line. So
Ah,
it's actually been shown in some studies to like improve scar outcomes. So
that's kind of cool. I
yeah.
never knew that. I love learning new things. One more thing I was thinking about, whereas we were talking about getting ready for surgery, what about, we're doing the skinny shot now here at La+Jolla+Cosmetic, and a
Mhm.
lot of people are on, some form of the Ozempic,
Oh, yeah.
Mounjaro, Zepbound, all the things out there, the compounded ones. And I know that that is something, because so many people are on it, that you might want them to stop how much
Definitely. Yeah.
before surgery, because you might think, oh, that's my diet thing, why would that affect my surgery? But talk a little bit about that.
Yeah, it's a good question. So, usually we have patients stop that at least 1 week before surgery and the reason is because when you're undergoing general anesthesia, we don't want you eating or drinking anything after midnight, usually the night before surgery. And we want your stomach to be empty so that when you go to sleep, you don't have reflux or aspirate anything like that. And the semaglutide, tirzepatide, those medications, they delay gastric emptying. So you basically have food in your stomach longer. We want that to kind of be out of your system enough so that your GI system is kind of functioning normally and we don't have to make you not eat anything for like 24 hours.
Yeah, yeah. So, yeah, because that's kind of a new factor
Hmm.
in anesthesia and surgery. So,
Definitely.
when they have their consultation with you, how can you show them maybe what they can expect for the after? Do you use like other patients before and afters? Do you have a way to do imaging on them, or what
Yeah,
tools?
so I mean, I take photos of all my patients, but for eyelid surgery, it's hard to kind of simulate in Photoshop or in a morphing program the outcome. So I think really the best way to show them what they can expect is by showing my other patients before and after photos and try to find somebody who has kind of similar anatomy, similar like concerns to them and show them, their eventual outcome. And also, I like showing, the 1 month, the 3 month, the 6 month, the 12-month result in other patients because it's hard to like explicitly describe how you're going to look different at 1 month versus 3 months versus 6 months.
Right.
But if you just see a picture, like, oh, that's what I can expect, and so it's
Right,
really
right.
helpful.
Yeah, that sort of continuum of healing. And
Yeah.
then lastly, I think patients might ask, okay, well, how much would it be for an
Well, yeah,
eyelid surgery?
it's a
So
reasonable
the
question.
the good news is we publish all our price ranges on our website. So you can just go look under the cosmetic surgery prices and scroll down and you'll see. And the range is like 7,000 to 12,500 ish. But again, that is dependent. You could think like, why is that such a big range? It's really dependent on what procedures you're having.
Mhm.
So to get a good idea of what it's going to cost is really having the first step is having that consultation with you, because then you can make the plan and the patient coordinator will whip up, here's how much it costs. But
Mhm.
because with eyelid surgery, there's skin only, skin and fat on the
Mhm.
upper, on the lower, canthopexy, I don't know, like all these little things that
Yeah. Little
you can do.
nuances, sort of.
Right. And so
Mhm.
sort of it's going to be hard for us to give you an idea without Dr. Riedler. You're
Yeah.
really taking a look at them.
Yeah. That's why we give like a ballpark range, and then we give you the exact quote when you come in and take a look at you.
Now, if the patient is, let's say they're in Atlanta, Georgia, and they're going to come to you, can they do a virtual consultation?
Mhm. Yeah, they can. Yeah.
Okay.
And yeah, I think that's a great option for out of town patients. I do like to see them at least one day before surgery just to examine everything, really closely
Hmm.
up close and personal and do an in-person exam before the day of surgery. But I mean, luckily with technology these days, I can see a lot and get a good idea of what can help them
Yeah.
and what
Yeah.
their anatomy is like just from a virtual consultation.
Okay, well, that's good news.
Mhm.
Well, thank you so much, Dr. Riedler, for coming on and talking about, the blepharoplasty, eyelid lift recovery. I think it really helps people to kind of get to know you as well as to understand more about what they might be looking at with this. It's a great procedure. And
Yeah.
so I might have to have now that I'm coming up on 20 years, we might have, you and I might have to talk about some things that I didn't do before.
Be happy
So,
to.
well,
Thank you for having me.
yeah, it was fun. It was fun. And so, everybody, thank you for listening. And you can find links to Dr. Riedler's eyelid surgery before and afters. All of our photos are on our website, and there's even more photos that you would see at your consultation
Mhm.
because some patients would prefer not to be on the website, but they don't mind Dr. Riedler being able to show you that that picture in the office or during a consultation. So there's lots more pictures even than you'll see on our website. But again, thank you, Dr. Riedler, and we look forward to seeing you again. We'll talk about noses next time, maybe.
Yep. I'm excited for that too.
All right. Thank you.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.